Hi, I'm Dr. Janet Allenby, and today I'm going to discuss something that not a lot of people do in their office. As a cosmetic dermatologist, I developed a way of putting Sculpted in the scalp. And what that means is that Sculpted is a product that we've had since 2004, and it grows collagen and it kind of forms tissue for us. And as we age, we are losing the structure of the face, whether it's from fat loss, muscle loss. Bone loss is also important, and what happens is as we age or if we lose a lot of weight, sometimes the face structure changes and we don't like that structure as much. What we have here today is there is a proportionality issue going on here. The forehead is small for the size of the face, and so what we want to do is, she doesn't have a lot of loss of tissue, which means she's hanging, but she is getting this kind of thinner looking forehead. And I'm doing this with a picture because we are still in a pandemic time and I don't want to not wear a mask, and I will describe this with a mask on, but I want to be able to have it fully understandable. So what's going on is she's proportionally a little bit smaller at this angle. Also the angle in the scalp, and let's go to this other side. In here, the angle's just a little bit too severe or angled back, where a forehead should be a little bit more square and it almost should be a little bit more forward. So I'm going to demonstrate, that way you guys can see what I'm talking about when I talk about Sculpted in the scalp. I'm actually placing it in the scalp, not in the skin so much. And I also do think there's a lot of where people tend to overinflate temples, which I'm not a fan of. A girl should have a little bit of a concavity or an indent, where a guy tends to be more flat. Sometimes you can tell when a girl starts getting a masculine look and she didn't have it before, and it's sometimes because somebody's putting a little bit too much filler in her temples. A lot of people don't realize that it can be done, and again, we've been using it for years very successfully prior to even my Sculpted threads, which is a whole other discussion, which is putting Sculpted in the scalp, but using threads to lift the face and kind of using the Sculpted almost more like a glue. Now, the Sculpted, it's not uncomfortable. It is within the skin against the muscle and then the bone, so it's not like it's going in the head or anything. So I do get people who ask questions, you know, is this going any deeper? Is it going to affect me, you know, in my brain? And it doesn't. Other thing that you do want to know about Sculpted in the scalp, it's a little tender, maybe for about a couple days usually. Sometimes people will have a bump in the scalp, but it's kind of under the hair, so it's kind of just part of a side effect that is something nobody really has to worry about, because it is something that's hidden, but you can. It's just the skin is so thin of the scalp and it's against the muscle that sometimes if you feel a little lump in there, it's just kind of holding the face up, and when they go away, and they do over time, it usually means you need to put a little bit more in. So we're going to go ahead and meet Christina in real time, and you get to see her, and we'll discuss it again, but I wanted to be able so you could hear me, so that's why I'm showing you the pictures on this one. Look at the difference here. Without threads, this is just Sculpted.
Oh my God, yeah.
Wow, what a difference. So it actually now has put your face a little more proportional. Okay, so I'm filming a little, I'm gonna put the thread through. So we already put some Sculpted in here, but I just wanna get it a little more numb. Now we're just gonna accentuate the cheeks a little bit here, and it's subtle, but it's a huge, huge change. Actually gonna go below the skin surface, so when the skin relaxes, it just, the thread does not stick out at all. You can open your eyes.
Oh my God.
Yes, and so now
Beautiful.
everything kind of is flowing back together again.
Look
you
at
know,
that.
We have the cheek shape, we have more front is actually getting a little bit more forward looking. And so now this is kind of the highlight of the face, where before it was kind of mid-face was the highlight. So now this is the highlight from here to here.
It's beautiful.
It's gorgeous. You did beautiful.
Thank you.
You did good. All right.
I love it. It's so beautiful.
So now I am going to put a little numbing in here, just to get the thread in and make it a little bit less uncomfortable, because it can get a little tender. Okay, that's it. Yeah. Oh. Ta-da! That's what. That's it.
Oh. All right, you guys. So I just finished my Sculptra thread procedure. Dr. Allenby is truly a genius. I instantly just feel so much better about myself and so much more confident, because I was looking in the mirror and I was noticing that, like she said earlier, I kept saying to myself, I feel very hollow, very empty. I felt like my brow was like kind of falling, and I'm only in my early 30s. And I'm somebody that has had filler. I've had Voluma, I've had Restylane Lift, I've had it all in my cheeks. But there comes a time when you need to know that there are other options for, you know, things that are going on with you specifically. So for me, I felt like my brow was falling, and I could feel that there was something missing here. And that's why, you know, when we take patients' photos and we do all these different angles, we're so used to seeing what we look like in the mirror, and it starts to really get to us. Like, oh, I feel like my lips look, I would say to Dr. Allenby, I feel like, you know, my chin, my face doesn't even bother me now in the down here, because I am so much more opened. My eyes are opened more. My forehead is opened more. Everything is symmetric. It's so beautiful, and I'm in love with it. And I think that I was saying to her, to Dr. Allenby, everybody needs to know about this. This is a different approach that literally within 10-15 minutes changes not only how you feel, but the way, you know, your symmetry is. So I love it. And also, I didn't do any filler in my cheek. This is just natural. Okay, I've had filler probably about 3 or 4 months ago, but we did not do any filler in my cheek. And look at that contour. Stunning.
So this is our after, and this is Sculpted in the forehead area, a little in the temples, not in the skin temple, but actually in the hairline temple, and a thread from the hairline back into the cheek to lift it and accentuate the cheeks. So what we actually really did was we ended up creating more continuousness of the face, so the face looks more joined together, where before it was having a little bit more of a disjointed look. And that's something that just happens. I'm going to show you a picture here. This is our before and after of Christina. On the this side over here is the before, this is after, and it's fairly subtle, but what happens is you can really appreciate that everything is more continuous looking. The forehead is more squared out. There's not so much of a peaking in the forehead area, which you can see kind of that peak going on there versus a kind of squared in here. That's kind of how, what I was trying to change with her. So it just makes the whole upper face look more attractive, and it's combining the cheeks to the forehead to the eyes, and it's slenderizing the front of the face. So the front of the face doesn't have as much projection. This is really an optical illusion, but that's how we see things, and that's what we were trying to achieve here, and I think she looks amazing. So congratulations, Christina. You're no longer a virgin.
Nope.